diabetes, what symptoms to look for. Diabetes is a disease that affects a lot of people of all ages. There are two types of diabetes, type 1 and type 2. A majority of type 1 is hereditary and genetic. Type 2 is usually a fruition of lifestyle and environmental factors. While the disease is not always completely preventable, for the most part it can be fended off for quite some time. Once you are able to put your finger on the major indicators of this disease, you'll have better odds of dealing with it and not let it disturb your life in any huge way. One of the optimal ways to be in charge as much as possible over the illness is to learn how to notice the major signs of diabetes. Diabetes sufferers often complain of more infections than average healthy people. Being more prone to infection can be a symptom of undiagnosed diabetes because your immune system is not as strong as it could be. Your doctor should test for pancreatic function to see if your blood sugar levels are where they need to be, especially if you are experiencing these types of infections. Urinary tract, kidney, skin and fungal infection caused by bacteria are among the most common causes of these outbreaks in diabetics. Do you experience sudden blurred vision? You won't always notice this if it's happening to your loved one. If it happens to you, though, it could be a signal that your body is having insulin problems and should be tested for diabetes. Diabetes can be referred to as diabetes mellitus. It is caused when body fluid is pulled out of the tissues surrounding the lenses of your eyes. Focusing your eyes when this occurs is difficult. However, blurry vision is also simply a sign that you need glasses. However, if it is only intermittent, you should consult your doctor. One of the indicators of diabetes that is more complicated to notice, especially in yourself, is when you are feeling unlike yourself. We all have days where we have difficulty paying attention. If you are suddenly feeling agitated, confused or even irritable and can't figure out why you feel that way, it could be due to you experiencing one of the symptoms of diabetes. It is effortless to recognize this in other people, but hard to see it in yourself. You might not even notice that you're acting funny. It's when someone asks, "What's wrong with you?" that you should find out. Sometimes it is just a bad mood. Periodically it is a warning that something is not going the way it should internally and physically. There are different signals of diabetes, but they can be powerful. The most pronounced indicators, the lack of insulin production, are complicated to discover without thorough medical testing. Other indicators are quite evident. At the same time, many of the noticeable indicators of diabetes are also noticeable indicators of other problems and disorders. It is imperative for you to keep a watch over your body, and the bodies of your loved ones. You don't want your illness to be diagnosed incorrectly. Find someone to give you a second opinion if you are concerned that your physician may have diagnosed you or your children incorrectly.